Hi, everyone. Thank you so much for joining us today. My name's Kayla. I'm on the Wasatch Crest marketing team, and we are going to talk about the healthy role of hobbies in recovery. Rich McDonald, our clinical director, and Adelinn Cook, our director of recreational therapy, will be giving the presentation. Before we start, I just want to go over a couple things. You guys can access this deck that you're seeing on your screen right now in the handouts bar on that GoToWebinar control panel. And you can download that and take it with you when this presentation is over. We also have a program overview handout in that same section, and it just kind of gives you an overview of what we're doing at Wasatch Crest and kind of what our offerings are. And we also have an admissions handout in that same tab. You can also download that, and it just goes over our admissions process. If you guys have any questions during the webinar, please don't hesitate to ask. You can ask your question in the in the questions toolbar in that same GoToWebinar control panel. And you can just type that in, and we will make sure Rich and Adelinn get that answered. I will throw it over to Rich and Adelinn to kind of kick us off.
Thanks. Welcome, everybody. Thanks again for joining us today. I'm really excited to hear from Adelinn. She's talking a lot about passion and meaning, and I don't know anybody on the planet that is more passionate about rec therapy and helping clients build a meaningful life in recovery. So she's got a lot of experience, and I always am kind of blown away by the insight and the work that she does with our clients on a regular basis. So that being said, I'll turn it over to Adelinn.
Thank you, Rich. Hi, guys. Thank you for joining us today. I'm really excited for this webinar. Just a quick intro of myself. I went to Indiana University, where I majored in recreational therapy and obtained a minor in counseling. I originally was a psychology major, but I quickly discovered that I wanted to enter a profession that combined my passion for recreation and leisure, as well as my desire to help others. I've been attending Al-Anon since I was about 16 years old, and I knew that I wanted to go into substance abuse treatment for a long time. I've worked at Wasatch Crest for just under 3 years now, where I've been the director of rec therapy for about 2 years. So with that being said, we'll go ahead and get started. I wanted to open up with one of my favorite quotes from a research article that I've based a lot of my treatment modalities on. It's about addiction and leisure specifically. So Faulkner says that addiction is a leisure disease and a disease of leisure. People pay for the feeling because they don't know how to get it for free. That is, they don't know how to play in a manner that produces the desired feeling. So people with substance use disorders spend every day thinking about when, where, and what they will use to achieve their next high. Substance abuse overcomes every facet of the addict's life until eventually their leisure time is totally consumed by addictive behavior. So what happens when the addict stops using chemicals and has free time on their hands? My hope is that this presentation will help answer this question and examine the relationship between addiction and leisure, and then emphasize the importance of leisure in a healthy recovery. So to start, I wanted to first define recreation and leisure, because I'll be using both of those words interchangeably. So recreation is a refreshment by means of a pastime, agreeable exercise, diversion, or any other resource that offers relaxation and enjoyment. Leisure is freedom from the demands of work or duty, when one can rest or enjoy hobbies. And I think that recreation and leisure are so important to recovery because A, it provides a diversion, so it keeps the mind off of using substances. B, it provides structure. It helps clients create scheduled times for activities throughout the day. And then lastly, it helps bring about positive affect. So there's so many physical, mental, social, and spiritual benefits of engaging in leisure activities. So for the science, hobbies and healing, what we know that abstinence is only a small part of recovery compared to lifestyle changes. This is why we have addiction treatment centers. Recreational therapy interventions, so like adventure therapy, leisure education, community integration, service work, etc., play a key role in the development of new skills so that these healthy changes can be successfully implemented into a recovery-oriented lifestyle. Outcome goals. So for the Wasatch Crest Recreational Therapy Department mission, I strive to provide clients with a variety of evidence-based modalities which empower them to rediscover their passions, develop motivation, and exercise survival skills to face trials and build meaningful lives in recovery. A few of the trusted interventions specific to recreation and leisure that I use to bring about positive change include adventure therapy, leisure education, community integration, and service work. So in rec therapy assessments, when I first meet with a client upon intake, I ask them about their past, present, and future interests. So what leisure activities did you engage in before you started using? What activities do you do when you're clean and sober? How do you spend your leisure time in active addiction? And then what activities would you like to explore or get back into? Leisure activities during active addiction are almost never constructive, beneficial, or healthy. I also ask them about perceived barriers to participation in leisure, such as physical, social, emotional, financial, family, lack of resources, lack of motivation, lack of transportation, and lack of knowledge. In the rec therapy treatment plans regarding leisure-oriented goals specifically, my job is to help clients diminish or overcome these barriers. Some of the things we work on with clients are improving socialization in leisure, increasing confidence in leisure, enhancing leisure resource awareness, and improving behavioral activation and motivation in leisure. So by completion of their leisure goal, I want clients to be able to answer questions such as, what activities can I do in my recovery that will keep me connected, make me feel good about myself, help me stay motivated, fit within my budget, be easy to access and close to home? And what activities are socially, emotionally, physically, spiritually beneficial to me in my recovery? How can I adapt these activities to keep in mind my physical, social, emotional, and financial barriers? And then some of the assignments that I like to give clients to achieve objectives towards their overall leisure goal include doing a leisure interest inventory where they look through all kinds of leisure activities and they check if they've done it in the past, if they currently do it, or if they would like to further explore it post-discharge. I also give them a worksheet called Planning Leisure on a Budget so they can kind of lay out all of their expenses and bills and then fit leisure into that. I've mentioned before in previous webinars that I like to have clients create a leisure calendar where they set aside, daily, weekly, or monthly time to engage in healthy hobbies. I also have clients make a leisure time pie chart where they can break down how they spend their free time, and they have a really nice visual of how they do that. And then one thing that I really like to do with clients too when they're in treatment is, actually make appointments and book sessions for leisure exploration. I've done that with a few clients recently. And it's kind of hard with COVID, but before all of that happened, we had one client that was really interested in doing volunteer work. So we called a lot of different places and set up opportunities for her to engage in volunteerism once she left. And we also looked at Bumble BFF, which is notoriously a dating app, but the BFF component of it, you can find people with similar hobbies and interests in your area. So we downloaded that app on her phone before she left so she could connect with other women. So she had that socialization component in her recovery. So I think that the whole idea that I'm trying to get at is to replace negative behaviors and deconstructive activities with positive ones. And the cool thing about leisure and addiction is that there's some really cool research and data, but I would also like to note that there isn't a whole lot on it. That's one of the reasons that I want to go to grad school and do research in addiction treatment with, recreation and leisure specifically. But one research project that I really liked is called the Health and Social Benefits of Recreation. It found from this research project that there's so many health benefits to recreation and leisure. Some physical benefits include reducing obesity, diminishing risk of heart disease, diabetes, cancer, and osteoporosis. Recreation and leisure helps boost the immune system and increases life expectancy. More specifically to the population that we work with, some mental health benefits include reducing depression, relieving stress, improving overall quality of life, boosting self-esteem, promoting personal and spiritual growth, and increasing life satisfaction. And also very importantly, some social benefits include strengthening communities and reducing crime, encouraging volunteerism, promoting social bonds, uniting families, building cultural diversity. Rec and leisure helps enhance educational outcomes and deters negative behaviors such as drug and alcohol use and crime. A couple more things from research that I really like on therapeutic, recreation, and relapse prevention intervention. So rec therapy in addiction treatment provides amazing benefits to those with substance use disorders. It gives clients the opportunity for structured, healthy leisure activities. It helps educate individuals about alternatives to the use of drugs and alcohol consumption in leisure time, and helps retrain negative thoughts and determined behaviors. Leisure education specifically assists clients in learning new coping strategies and discovering gratifying methods of engaging in leisure. And what I really like in this article from Deiser and Voigt is that they mention mild exposure therapy and recreational therapy interventions. So intentionally putting clients in, mildly risky situations. For example, an outing that I really like to take clients on is to a local bowling alley here in Heber City. And they do serve alcohol at the bowling alley. So I make sure to have a clinical therapist with us on that outing whenever we go. But, I put it out there like, hey, guys, like, this place serves alcohol. If you are at all feeling triggered during this outing, please reach out to us for support and we'll help you work through it and utilize your coping skills. But it's a really great way to kind of immerse those clients into a situation that they might encounter once they leave treatment. So another some more research that I really like is on women in recovery from alcoholism specifically and the place of leisure. This research study examined recovery-related experiences of women in recovery from alcoholism with a particular emphasis on leisure. So the participants in this study found that leisure involvement was critical to moving beyond just not drinking towards true long-term sobriety. The participants discovered that learning how to experience leisure without the mediation of alcohol was extremely difficult, but they began to recognize its benefits in rebuilding a non-alcoholic identity and a meaningful life. At the end, the participants reported having learned more about themselves. They learned how to accept and appreciate their own attributes and limitations, and how to take risks as a means of developing self-awareness. Finding meaning, developing a life of passion. So self-care is critical in recovery. And where I come in with that is teaching clients how to explore and implement recreational and leisure coping skills for recovery. So just a few examples include baking, reading, going on a walk, doing yoga and meditation, just doing things that bring a sense of accomplishment. And what's cool about leisure activities is that they can help prevent a buildup of stress. So if you're regularly, going on walks and doing yoga, it helps prevent that buildup of stress hormones, cortisol and adrenaline. And these leisure activities as coping skills can immediately address the symptoms of things like anxiety, depression, and stress. And engaging in these leisure activities have so many different benefits, socially, emotionally, physically, and spiritually. And one thing that I think is really important to hit home with clients is that it's so important to make time for self-care. So scheduling time daily, weekly, and monthly, things that you can do in your leisure time to make sure that you're taking care of yourself and you're helping prevent that buildup of stress. And I think it's good also when we're scheduling that time to provide options or a plan B. So if we're looking at, you know, AA or NA meeting schedules, you know, writing down like these are the 2 or 3 meetings that I can go to on this day if I can't make one of them. So having that plan B is important. As far as new experiences, I think it's really important that we experience novelty and leisure. So discovering new passions and setting aside past judgments. It's really great to continue doing something that you're good at, but you may miss out on an opportunity to discover new skills and build those skills in a different area. So I think it's important to be open-minded and willing to try new activities in recovery. And then one thing that's important too is the inherent risk of certain recreational and leisure activities. So a lot of clients come through here and they love to experience the adrenaline rush. It's one of the questions I ask clients when I ask them about their coping skills. Like, do you use your coping skills to experience that rush? And if they do, if they use substances to experience that rush, then one of my jobs is to help them find a recreational activity that replaces the substance so that they can still experience a healthy rush. Because some activities just present an inherent risk, meaning that there is a possibility of danger. So obviously I help support the clients in mitigating the risk in whatever way they can, but also exploring activities that give them that healthy rush. So as far as early versus long-term recovery, I think in early recovery, it really starts with the willingness to try new things, like I mentioned. Early recovery is primarily about leisure discovery. So, you know, rediscovering passions, learning how to do old leisure interests clean and sober, and then stepping outside of the comfort zone to try new activities that don't have the memories of substance use attached to them. And then also very imperative in early recovery is the connection piece and socialization in early recovery. So finding activities that clients can do with other people is so important. For example, setting clients up with information on how to access sober softball leagues, getting into the recovery rock climbing community, things like that. And, you know, like 2 of the main goals of recovery are rebuilding those relationships and learning how to enjoy life again. And leisure is an ideal context for the redevelopment of family bonds and relationships while having fun at the same time. Many people in early recovery find it difficult to imagine having fun without using drugs or alcohol. So I think that exposure to leisure activities without substances is just so beneficial in treatment in early recovery. And then for long-term recovery, I think the biggest piece is committing to leisure. So setting aside time, creating a daily schedule, you know, at least one thing that you can do each day or week to take care of yourself and have fun. And I make sure to let the clients know, like, it doesn't have to be this huge, extravagant trip that you take, just something that brings you intrinsic satisfaction. So when you get home from work, turn the TV off and instead maybe journal, you know, doodle, paint, listen to a podcast, do something that is going to engage your brain or your body. So paving the way for passion, helping clients have meaningful fun. In our experience here at Wasatch Crest, finding appropriate activities has been oftentimes a trial by error situation. So we've learned a lot from taking clients on outings. But first and foremost, I think the most important thing is seeking guidance from the entire clinical team about leisure activities. So knowing what clients have limitations and how to approach that appropriately. So for example, an escape room outing would probably not be appropriate for a client with substance-induced psychosis. Hatchet throwing might not be safe for someone with a history of violence and aggression. Laser tagging might not be appropriate for a veteran with PTSD. And then someone with a personality disorder, I think that setting boundaries and providing a lot of structure is really important. And I know Rich and I talked about that a lot last week when or 2 weeks ago when we were talking about nature and talk therapy. Making sure that you set those boundaries with that client is really important. And then other ways to make sure that an outing is appropriate for a client, I think it's important to make sure that we provide modifications and adaptations so that clients can still participate. So for example, I know I've mentioned before, splitting the group up on a hike and letting them know that they can either, do a shorter hike and do a journaling activity with a staff member, or they can go on a longer, more difficult hike. When we go kayaking and paddleboarding, I don't just reserve paddle boards. I make sure to reserve tandem kayaks and single kayaks too. So if there's someone who isn't comfortable being alone in their own kayak, they have that extra support and can have someone with them. And then also I like to inform clients ahead of time what the outings will be so they know what to expect and they have something to look forward to. At the same time, I never disclose specific locations. For example, we had this client one time who invited his family to meet us on an outing, which was just not appropriate at all for many reasons. We also had a separate client who was really involved in archery, and I let him know the day of where we were going, which archery range specifically, and he told me that he didn't want to attend the outing because that was an archery range that he frequented, and he wasn't comfortable showing up there with his, with his treatment group. So I think that, providing an alternative for clients like that, like the one that couldn't go to the archery range with us, is important. So I made sure that he had things to work on, like assignments, so he could stay back at the house and be busy. But I also made sure that he took time for himself to engage in self-care activities. Okay, so some strategies to encourage participation. I think that freedom of choice, like I've mentioned before, is super important. So asking the clients what recreational activities they would like to try in treatment. For example, on Wednesday, we can either go river tubing or we can go fishing. What do you guys want to do the most? And I often take a vote, and then whatever doesn't get chosen, we'll end up doing that activity at a later date. And then I like to also offer clients the opportunity to help me co-facilitate and plan activities. So I ask them if participating in this activity is just way too far outside of your growth zone, how else do you think that you can still participate or support your peers? Or would you like to help me plan this outing? So it's giving them that power, and they can help facilitate. And I found that clients really enjoy doing that. They feel important and respected, and they feel included still. And back to that growth zone thing, I like to talk to my clients about this. I let them know that everyone has their comfort zone. This is where we feel safe. We're in our little bubble. Just outside of that comfort zone is our growth zone or a stretch zone. And, this is where learning happens and where we push ourselves past that comfort zone. And just outside of that is the danger zone. So that's where panic attacks happen. That's where things aren't safe. But I let the clients know that I want them to be in that growth zone. I want them to get comfortable with being uncomfortable. And sometimes that helps, just giving the clients a little extra push. So for application and ideas, like I've mentioned a little bit ago, I think that leisure immersion is critical in early recovery. So getting the clients excited about trying new things. And I realized that if I'm really excited about a leisure activity, the clients tend to be excited about it too. And I like to periodically talk about my personal experience with specific activities, especially ones that pose a greater inherent risk. For example, rock climbing. So whenever I take the clients rock climbing, I like to talk about how the first time that I ever went rock climbing, I was really anxious about it. I didn't trust the equipment or the person that was belaying me, but I really pushed myself into my growth zone where I was feeling a bit of anxiety and fear. And after that, I'm so glad that I did it because I learned so much about myself and how resilient and strong I am, and that I am capable of doing something like that. And I think that sharing those personal experiences with the clients, it just helps create a little more like empathy, compassion, and piques their interests in activities. And then for more application and ideas for post-treatment planning, whenever I am on an outing, I like to, drop a few ideas to the clients like, hey, this is a cheap activity that you can do with your family, or this climbing gym offers discounted couple passes, or this park that we're at right now has a dog park so you can bring your fur baby. Or when we do volunteer work at the dementia care unit, I like to let them know that, hey, this is a really great way to give back and connect in your recovery. And then other ideas, processing. This is probably the most important part of all of the groups that I do, but especially on outings, because there's so much symbolism and metaphors that can be taken from the outings and activities that we do. So processing how to relate the experience back to real life situations in life and recovery. So I found that, often if clients are struggling to advocate for themselves, for example, at the ropes course, it can often translate back to their struggle to ask for help in other situations outside of that setting. When we go river tubing, we talk about how we struggle to control the flow of the river, and people are paddling really quickly, trying to prevent themselves from like crashing into the banks and stuff. And more times than not, if you just sit there and let the river take you, you don't have any issues whatsoever. So we talk about how that translates back to real life and our need to control situations. So there's always some type of component that you can take from these activities and relate it back to life and recovery. So for our experience at Wasatch Crest, I found that some clients can often be resistant to activities such as hiking. They'll say, I don't see the point of hiking, it's my least favorite thing to do, or there's nothing exciting about this. So what I like to do is implement some type of activity for the clients to do on the hike. Like before, I've mentioned the 5, 4, 3, 2, 1 technique, doing a mindfulness activity such as having them hike barefoot so they can just be more aware of their surroundings, or implementing some type of journaling activity that they can do. And then I just also wanted to give some examples of outings that we like to do at Wasatch Crest. Right now it's getting a little bit warmer, and because of COVID, we are limited, but we're still doing lots of fun stuff while maintaining safety guidelines. We like to go river tubing and rafting. We do outdoor rock climbing. We have a contract with the uni ropes course, so we go there once a month. I like to take the clients disc golfing. Periodically, we go to the park and play volleyball or softball. And when it's safe again, we'll get together with another local treatment center and we'll play volleyball and softball against them. We like to go camping, backpacking, fishing, hiking. And then another monthly thing that we do year-round is the Lakota Sweat Lodge. And then some cool ideas for cooler months include hatchet throwing, snowshoeing, doing museum visits, doing volunteer work, like going to the dementia care unit, doing habitat restore. So we go to the Habitat for Humanity restore facility and we just kind of help clean up. We help customers load and unload furniture and things from and into their cars. And then in the past, we volunteered at the Humane Society, which is one of the client's favorite volunteer outings that we do. We also do snow tubing, bowling, arcade games, and laser tag. We go ice skating. Lots of fun stuff that we do here at Wasatch Crest.
Awesome. You know, I think just to kind of set that up, I think one of the things that's been really powerful is the collaboration with the other clinicians in the clinical team and taking the experiences that Adelinn has, and we also encourage the therapist to go with Adelinn on the outings. But there's so much crossover into the activities and different experiences that they have maybe in the group setting. It's a great way to kind of take a look and help the client kind of gain insight into their response to being frustrated, anger, cooperation. You know, a lot of times they'll share with me that one of the clients was struggling because they felt like it didn't go as planned. So it's really a good opportunity for us to discuss the fact that they need to expect that life is not always perfectly planned out and make adjustments on the fly and have a plan B, like Adelinn said. I think the piece of the rec therapy that I love the most is really we're teaching them a lifetime skill, and they're able to apply it in their recovery outside of treatment. But one of the greatest experiences I've had with clients is watching them complete something they thought might be difficult. So I will oftentimes have them say, oh, that's too hard. Do I have to go that far? And, you know, we always want to make sure we're being appropriate for each client, but allowing them to kind of work up to a goal and getting to the top or the end of a trail or to a waterfall and really feeling good about the fact that they could do something. A lot of times it's been a long time since our clients have actually set a goal and achieved it. And these little goals along the way help them feel a real self-worth and a sense of accomplishment that is really important early on. Sometimes the big picture is daunting, and being able to get to these smaller accomplishments and finish lines makes a big difference.
Absolutely. And so there's also a really great mindfulness component to the work that we do, especially on our outings with recreational and leisure activities. We recently had a client who was here, and he expressed some frustration about going on all of these hikes with a big group like that and not being able to be independently hiking and experiencing nature in his own way. So I sat down with him and we talked about coping skills, ways that he can kind of deal with those situations and his frustrations. And he admitted that he doesn't really get anxiety. He just felt a little irritated that he has to be in such a structured setting with so many other people. So I talked to him about the 5-4-3-2-1 technique, where he's checking in with all of his senses, because it can be used for someone who is experiencing anxiety, just so they can orient their senses and their surroundings. But it can also be used in positive situations too. So I encouraged him to check in with all of his senses the next time that we're on a hike, because what it does is it helps create a sense of gratitude for your surroundings, because it's really easy to be frustrated when you are an avid hiker like this client and he's in such a controlled setting. And he reported back with the use of that technique, and he says it's been really helpful and it's helped change his perspective on outings like that.
Awesome. Thanks, Adelinn. I actually had an experience with that client. He shared it with me yesterday that he has really been able to shift his thoughts when he's out on the trail. And, you know, his phrase was, I actually stop and smell the flowers. Which I thought was beautiful. And that was something that he learned from Adelinn, and it's pretty cool to see it working. Our last piece is the implementation for each level of care. And I think really the points to touch on with this is that when we're in a residential setting, it's going to be highly structured. There's specific expectations and goals, and it's very well monitored, and that's where it needs to be at that level of care. But as we transition clients through the continuum of care and they get to an outpatient setting, I like to encourage clients to begin to do some of these things outside of treatment with their peers, where they're actually engaging with other people early in recovery. And I've mentioned like Addict to Athlete and some of the other YPR and sober softball before, but those kind of activities where it's self-directed is really important. So I like the idea of having our clients in day treatment or evening IOP to set up a night during the week where they all go for a hike together. It allows them to kind of be themselves and then also see the value in spending time with their peers without being forced or required to do it. One of the, I think, coolest things that I've seen, at least from my perspective, around finding passion in recovery is a client that did a bunch of hiking with us here. He's from the East Coast, and he left treatment, did well, and really started loving to get out and trail run. And I received a message from him probably 12 months or so after he completed our program, and he had emailed me with a picture of his finishing medal from a 50-mile race. And he said, "This is the first time I think I've felt that I was actually good at a sport." And in further discussions with him through kind of the alumni programming, it's been a huge part of his life, and it still is today, several years later. It's really our job here to help them identify those things and become inspired and get excited about living a sober life again. So.
Absolutely. And one of the things that I really try to implement with the clients is a sense of independence as they get up to like a different level of care. So for example, one of the things that the clients have to do to complete treatment is they have to help me plan and facilitate some type of recreational therapy group. And the clients love helping me plan the outings and then coming up with processing points to talk with the rest of the group afterwards. And then another thing I like to do with the clients is take them on maybe a little more like longer outings or things that, you know, we can't really do with the whole group. Something that I like to do periodically with just a couple clients at a time is go fly fishing. So introducing clients to that activity, it can be really beautiful to watch them light up and try something new. When it's snowy and cold outside, we like to take the clients in small groups skiing and snowboarding, and it helps them to experience in a bit of a less controlled setting. We're still there, but it's a smaller group, so it feels more like, you know, the clients are hanging out with their peers and they're engaging in something that they enjoy. So I think that that's really important for the clients who are getting closer towards their discharge date, so they can experience that and have that sense of independence.
Absolutely. So does anybody have questions and anything we can answer? Thanks for spending time with us today.
Hey guys, that was great. I don't see any questions and I don't want to go over anyone's time. So let's just skip that section, and Rich, if you'll scroll down, we can give a preview of the next week. So next week, we are going to be talking about avoiding rock bottom, how providers can catch signs of addiction early on. And then the following week, we're going to be talking about the role of family in addiction treatment and recovery. And then we will get some more webinar topics for you guys to sign up with. So look for that in your email to register. And then if you'll scroll down again, Rich. please. The first 10 attendees will receive a Starbucks gift card for this session and for the following sessions. So look out for that in your inbox. It's 1 gift card per person for the entire series. And yeah, look out for an email to register for our upcoming webinars. And then Rich, one more time, will you scroll down, please? And then that's our contact information. Call us to learn more about us. Our website is wasatchcresttreatment.com as well if you wanted to visit that. And then please feel free to take those handouts about our center in the handout section of this webinar. I think that's all we have, so thank you all so much. Thank you, Rich and Adelinn, too.
Thank you.
Thank you.
Have a good day.
Bye, guys.